Morning, everyone. My name is Gail Day. I am the Executive Manager at the Free Market Foundation. Today, we are launching the fifth in a series of 8 booklets titled Laws Affecting Small Business. The series was first published by the FMF in the late 1990s. As red tape continues to undermine business, we have updated the series, which deals with finance, health, justice, labor, land, licensing, schooling, and tax. Gary Moore is the senior consultant at the Free Market Foundation. He was a practicing attorney in Johannesburg for 30 years, and it is he who is responsible for updating the Laws Affecting Small Business series. Gary will be presenting health. Thank you, Gary.
Thank you, Gail. So, health laws. They aim to protect the public, but often their benefits are unproven, and their costs to businesses and consumers are unduly high. Small businesses, in particular, are hampered by inappropriate health laws governing restaurants, foodstuffs, liquor, smoking, creches and childminding, boarding houses and small hotels, and abattoirs. The laws are barriers to entry in preventing many people from starting business and creating employment. Most of these laws, by controlling only goods or services sold to the public, and not all goods and services, are not really health laws at all. They're buyer protection laws. To summarize, as an introduction, we propose a repeal of a number of health laws. If total repeal is unattainable, they should be substantially relaxed. There's a widespread misconception that in the absence of legislation, the consumer is unprotected. That's not so. Common law will still apply, and to provide adequate, often better protection against people who endanger public health. Take restaurants and takeaways and caterers. Health legislation regulating the premises and equipment should be repealed or limited to what's strictly necessary for health. Environmental officers should not enforce legislation, but provide guidance, education, and training. As to foodstuffs laws, they criminalize the sale of unsound food. Those measures should be repealed, and reliance should be placed solely on the laws requiring food manufacturers to have procedures to analyze the hazards at critical control points, the so-called HACCP procedure, and to have steps in place to avoid those hazards arising. Liquor laws. Restrictions on the time when bottle stores can sell liquor should be removed. The Provincial Liquor Acts, which treat liquor as a special commodity that must not be offered for sale alongside other goods, should be repealed. The provision against making skokiaan and the like should be repealed. Smoking laws, laws that prohibit smoking in so-called public places and workplaces should be repealed. In all privately owned property, the right to smoke should be by voluntary agreement between proprietors, employees, and customers. The prohibition against advertising tobacco products should be repealed. Now, I'm chasing through it, but this is just an overview summary. I must say it seems implausible till I get into it for you later. Childcare, the provisions of the Children's Act, which criminalize unregistered childcare facilities, should be repealed, and the authorities should attract childminders by offering expert assistance and guidance. If there are to be regulations, they should contain only the minimum necessary. All special bylaws for accommodation establishments should be repealed. As to occupational and building health laws, they should be replaced by a single measure that working conditions should be healthy. As to abattoirs, the Meat Safety Act should be repealed. Informal slaughter should be legalized. If there has to be a grading system, an abattoir should have the right to process any number of animals in a day in batches up to its maximum throughput for that grade of abattoir. Local authorities should establish communal slaughter places for small-scale slaughterers to slaughter their animals. A poultry abattoir should not be required to have a refrigeration facility if the products will be sold directly to the final consumer. So, in more detail, restaurants. Health legislation regulating the premises and equipment of restaurants and the like should be repealed or limited to what's strictly necessary. There are national regulations which are intended to protect customers against falling ill from unsound food and dirty utensils, but they cannot guarantee either cleanliness or good food. In fact, food poisoning is extremely rare. Regulations stipulating that interior walls of premises must be rust-free, dust-proof, and water-resistant and the like should be repealed. Laws, same goes for the rules giving the minimum dimensions of a window and specified number of latrines, urinal stalls, and hand wash basins. And the requirement that a person in charge of food premises must obtain a municipal certificate of acceptability. The benefit of these measures is probably slight, but the cost to a small cafe or restaurant of complying with these and other stringent and arbitrary measures can be crushing. They are routinely breached, these measures, by both formal and less formal establishments. Officials should focus not on whether regulations are being observed, but rather whether the business is being run with proper and appropriate attention to hygiene. People have a false sense of security. They believe the regulations and officials can protect them from harm, but not so. The only effective way to protect the public against eating contaminated food is to analyze every meal and dish before it's served, which is of course impossible. In practice, what happens is health officers react to complaints, and very commonly another restaurateur complains in the hope of putting his competitor out of business. Responding to the complaint, an official arrives, inspects, identifies features that do not comply with the regulations, and orders the restaurant owner to remedy the shortcomings in a period of time. At the risk of being prosecuted, the food poisoning is not avoided and cannot be prevented from occurring in the future. Analyses in Cape Town and rural KwaZulu-Natal show that foodstuffs supplied by street vendors are seldom, if ever, unsound. The reason is that they're cooked and sold almost immediately. A real environmental threat is infection from dirty hands, and regulations say that restaurants must have proper hand washing facilities and personnel must wash their hands regularly. This is most essential, but practically unenforceable. Environmental health laws simply create unnecessary expense. Restaurants do their best to provide good food to the public, not in deference to the regulations, but so that customers will come back again. There is some recognition in official quarters that existing regulations are unduly stringent, and some recent regulations contain relatively reasonable requirements. And enlightened health officers adopt a more flexible policy sometimes. Yes, but strict regulations are still on the books, and a flexible approach in applying them can lead to discretionary and arbitrary enforcement. This creates a public perception that the law is what the officials choose to enforce rather than what the law says. And regulations also allow owners of food premises to apply for municipal exemptions from any of the regulations. This is, it would be preferable if the existing stringent legislation was replaced by more reasonable and appropriate measures that can be uniformly and consistently applied rather than leave it to the discretion of the inspectors. Some people may prefer to have higher standards in some communities, but that is an elitist view. You can't have two different health standards for different communities. The primary responsibility of environmental health officers should be to provide guidance about hygienic methods, and the real risks often arise out of ignorance rather than lack of compliance with regulations. And the National Department of Health acknowledges that environmental health education is the most effective means to improve hygiene practices. What determines the quality of food is the way it's handled and whether it's consumed before it goes off. That's all that matters. Regulations regarding equipment, utensils, and premises and the like are really irrelevant. As to foodstuff laws themselves, these also have the stated purpose of protecting health, and the criterion, though, is whether the goods are being used in trade. If food will not be sold, then the law disregards a threat to health, as in the home, food prepared for your own family. The Foodstuffs Act prohibits the sale of food that's contaminated, impure, or decayed. But food that's not sold doesn't have to comply. They have a requirement that poultry meat and fish used in a business involved in the handling of food must be conveyed in a vehicle with a temperature of 4 degrees or lower. These rules don't apply to premises not used for food businesses. So a housewife who carries on a bed and breakfast business must comply, but not for the food that she has to serve to her own family. There's a perception that meals made in the home will be prepared with more attention to hygiene, but this is not really the case. All these laws which control food in trade are not health laws, but merely bioprotection laws, and should be administered not by the Department of Health, but by the Department of Trade and Industry instead. Reliance should be placed only on these HACCP measures, the procedures for analyzing hazards at critical control points. These are also being prescribed under the Foodstuffs Act, and all the other regulations should be scrapped and reliance only placed on this HACCP system. Public health will be better served by focusing entirely on a careful production process. This will also satisfy countries to which we export food products. As to liquor, restrictions over the times when bottle stores can sell liquor should be removed. Current provincial liquor laws are less restrictive than the previous laws, but they still impose restrictions in the name of protecting public health, which on examination are not really justifiable on health grounds. The liquor laws are an amalgam of conflicting policies. On one hand, they permit the sale of liquor. On the other hand, to accommodate various sentiments about liquor's harmful effects, they impose various constraints which are capricious and illogical. The acts commonly decree that a liquor licensee may sell either for consumption off the premises or on the premises, but not both. Liquor laws are required to close earlier on Saturdays and again earlier even on Sundays. To justify these restrictions, it's said that excessive consumption is harmful, and that it's therefore justifiable to restrict times when liquor may be sold for off-consumption, on the weekend especially. But these, you can bypass these laws. You can, by buying as much as you want during the week and on Saturday and Sunday morning before the liquor stores close. And people can drink liquor all night in bars and shebeens. These measures only restrict business activity and are an inconvenience to the public at the same time. The laws declare that a person who is drunk in a public place commits an offence, but they don't prohibit private drunkenness. The real intention is to prevent offensive scenes in public, not to discourage alcohol consumption per se. The Liquor Act's provisions, which treat liquor as a special commodity that mustn't be offered for sale alongside other goods, should be repealed. It's inconsistent that the holder of a grocer's wine license can sell wine alongside groceries, but if you've got a regular hard liquor license, you can't. The government acknowledged that the criminalization of liquor traders has ironically led to a regulatory breakdown, so that the state licenses fewer than 10% of the estimated 250,000 liquor outlets. In 2014, it was recommended that the majority of the 200,000 shebeens still remain unlicensed. Even though the legal requirements have been relaxed, they're still too stringent for the vast majority with small turnover and modest profits. Countries with strict codes on liquor sales, such as the Scandinavian ones, have more problems with drunkenness than the Southern European ones, where liquor is treated like other commodities and altogether there's a more relaxed attitude. The only rule that you can justify is the prohibition against selling to people under 18. The prohibition against making skokiaan or similar drink from fermenting treacle and sugar, also called barberton or hapana, should be repealed. They don't have the same rule against Mampur, which is drunk mainly by whites, And looking back in the history in the old court cases, it's clear that the whole purpose of banning Skokiaan was to discourage black people having any drinks at all. That was from a time when it was forbidden for black people to purchase liquor at all. Those laws have now been scrapped, but the Skokiaan rule is still on the books. It was quite clear from the old court cases that the judges were only concerned with discouraging consumption of liquor by blacks. It's an apartheid relic. The law prohibiting smoking in so-called public places and workplaces should be repealed. In all privately owned property, the right to smoke should be determined by the owners in agreement with their employees and customers, whatever suits them. This rule against public smoking covers any shopping mall and prevents businesses from accommodating customers who smoke. The prohibition extends to any indoor workplace where employees work. Experience, though, is where workplaces are made non-smoking areas. Some employees leave the area to smoke outside. People in a workplace will be unable to make their own arrangements regarding ventilation because of the flat prohibition. The statute is not aimed at protecting smokers, who are the people most at risk of falling ill, but it's aimed at protecting non-smokers. It's not a health rule at all. It's a rule for the convenience of the majority who don't smoke. And there's a very much more intrusive tobacco products bill about to be introduced in Parliament, perhaps later this year. There's not much time left, or early next year, and that should be scrapped as well. And the prohibition against advertising tobacco products should be repealed. This hits billboard suppliers and sign writers, many of whom are small businesses. This criminalizes the display by a tobacconist of a cigarette box. A retailer is allowed to post a prescribed sign that says boldly, tobacco products is available here, but it mustn't have any logo or anything. There's also a law banning the use of a tobacco brand for the purpose of advertising any service or sport or event. So this restricts the income available for sports matches and has the effect on small businesses in the sector, including sportsmen and businesses in the fields of security, parking, catering, cleaning, and the like. I'm thinking of the Rothmans Durban July. I don't think they're allowed to call it that anymore. The 1993 legislation also prohibits sale of tobacco products to persons under the age of 18, and the fine is 100,000 Rand, a maximum fine. But a person who contravenes the prohibition against using a tobacco brand to advertise is liable to a fine of 1 million Rand. So that suggests that the commercial crime is regarded as 10 times more serious than supplying cigarettes to children. There's no logic behind these fines. People smoke not in response to adverts, but because they find smoking pleasant for its stimulating effect and because it promotes concentration. Suppressing all advertising creates a perception among the young that smoking is an illicit activity to be pursued. Any decline in smoking is due to a growing opinion that it's harmful to health, not because of the legislation. Childcare. The provisions of the Children's Act, which criminalize unregistered childcare facilities, should be repealed. Thousands of creches and daycare businesses undertake part-time care of children, and most of them are unregistered. A person might operate a partial care facility only if the facility is registered, says the law, and municipalities say that a child care facility for 6 or fewer children must also obtain a municipal health compliance certificate. But these measures are widely disregarded. There are probably more children in unregistered or uncertificated facilities than in registered certified ones. The result of criminalization is that those who are uncertified or unregistered don't receive the benefit of any education and guidance. And here, a good example of a burdensome law is the eThekwini. I had to reach for this one because it's this, goodness me, it's the eThekwini childcare bylaw. eThekwini is Greater Durban, effectively. It encloses 200 places, including Durban, Chatsworth, Cato, Amanzimtoti, Emalangeni, Inanda, KwaMashu, Msunduzi, Phoenix, Pinetown, Umlazi, Westville, and the like. So it's very large. There are 3.5 million people live there. The first language of about 2 million, pardon me, 2 million of them is Zulu, and of another million is largely English, some Afrikaans. This bylaw has some choice measures that comply. It applies throughout that entire eThekwini area. Your childcare facility must comply with national building regulations, must have a portable fire extinguisher, not less than 1.5 square meters of free floor area per child indoors. Outdoors, 2 square meters of outdoor area per child. There must be a wash hand basin for every 20 children, a double bowl sink, hot water supply, separate toilets for boys and girls of school-going age, nappy changing area, a sick bay, and an incident book. The person in charge of this childcare facility must keep a diary or other similar incident book for recording events that occur in connection with the children. And these bylaws are not being observed at all. If there are to be regulations for childcare, they should contain only the minimum necessary. The law should focus not on registration, but on the true health and safety of the child. And it's irrelevant really whether a place is registered or unregistered. In some places, universal rules of this kind won't be enough. More prosperous parents may demand higher standards, and there's nothing to stop them from seeking out a childcare facility that wants to meet extra requirements and advertising that it does so. Boarding houses, all special bylaws for accommodation establishments should be repealed. Carrying on a business as a bed and breakfast, often from your own home, is a business opportunity for many business, but unnecessary bylaws increases the cost of entering these and carrying on the business. Bylaws often say that premises must comply with requirements with separate ablution facilities, including 2 baths, minimum floor area of the dining room. But the real criterion is to control business, not the health of the public. Compliance with general building regulations should be sufficient. There are complex and diverse requirements concerning health in many other statutes. They should be reviewed. A systematic analysis should be undertaken. It will be found that most of them, again, are not true health laws and can be cut down to a bare essential. The Meat Safety Act should be repealed. The health benefits of these are indirect only. The meat safety legislation allows many arbitrary discretions and exemptions. It's clear that these exemptions are granted for social or economic reasons rather than health ones. Abattoir legislation is widely ignored. About 80% of sheep are slaughtered illegally. The Meat Safety Act requires slaughter only at an abattoir approved, registered, and graded by a designated vet. Meat from an animal slaughtered at any other place may not be sold to any person. This is a vain and unenforced rule. The yardstick to measure the grade of an abattoir is its throughput, maximum allowable number of animals that may be slaughtered there each day. Each grade of abattoir must have specified facilities. If you reach your maximum throughput before the day's end, you must stop for the rest of the day. So says these regulations. They should be relaxed to allow more consumption, particularly in a poultry abattoir. Additional requirements are prescribed for higher grades of abattoirs: fencing, lairages, minimum floor space, lairage passages, a room where, okay, it gets a bit gruesome. I won't give you all the details. Chillers equipped with accurate thermometers are required, but the Act does not apply to animal slaughter for own consumption, to use the wording of the Act. Again, there's no valid grounds for allowing someone to slaughter outside an abattoir for own consumption if your requirement is truly a health requirement. The legislation lays down an ideal for inspection by a registered veterinarian or meat inspector that can never be attained in practice. There used to be 1,000 abattoirs, but since the national legislation of the 60s, there are now fewer than 300. The meat scheme, also now fortunately done away with, also benefited big business and encouraged centralization of abattoirs. The old policies caused closure of many rural abattoirs, which harmed the rural economy. Undernourishment is prevalent among many communities, and there's a need to make protein available cheaply. Excessive capital investment in infrastructure is often unaffordable. Any exporter, though, who wishes to export to another country would have no choice but to comply with that country's requirements. That is fine. The numerous exemptions in the abattoir legislation discredit any argument that the law has an essential health purpose. Nearly there. In 2017, a study of post-slaughter handling during distribution on microbiological quality and safety in the formal and informal sectors concluded merely that foodborne disease, a common public health problem worldwide, is generally underreported and poorly investigated, but they've made no firmer finding than that. The Act should follow international trends and move from the preoccupation with building standards to a more holistic emphasis on hygiene management. Local authorities should establish communal slagpale, as used to be the case, where locals could bring their animals to slaughter. Finally, a poultry abattoir should not be required to have a refrigeration activity if the meat and animal products will be disposed of directly to the final consumer. Where no butcher or carrier intervenes, it's unnecessary to have refrigeration in an abattoir. It's expensive to provide. You can still require refrigeration if poultry will be transported over a long distance or delivered to retail butchers, where there's a risk of infection on the way. That is it all, Gail.
Gosh, Gary, thank you very much indeed. That was very comprehensive. I think you mentioned at the beginning that this would be a fairly controversial discussion and perhaps a hard sell in many ways. Yes. And while you were talking, I was just thinking, that really the focus should be on the consumer, that the consumer is king, something we've said for years at the Free Market Foundation. And that it's really a fairly simple thing. If you, don't poison your customer if you want his repeat business. And I think that probably is sufficient rule right there. But thank you very much. If there are any questions, perhaps you could just raise your hand and and then unmute yourself, and then you can chat to Gary. Or if you want to, you can type it into the chat. I'm just going to open the chat up and see if there are any questions there. If anybody would like to ask a question, please do so.
Yeah, Gail, may I comment?
Please, Tembe, if
Temba.
you could just raise your voice a
Yeah,
little.
yeah, okay. Pardon. Can you hear me quite clearly now?
Yes.
Yes.
Oh, yeah. What I want to say, first of all, is that this comprehensive presentation by Gary is something that the doctor has ordered that the country needs. It is so cogent, it is so self-explanatory that it should not actually be a hard sell, especially if one looks at what is being presented from the perspective of what is in the best interests of the customer at the end of the day, and also economically what is in the best interest of the country overall. Because we're talking about small businesses, the focus is on that. That is where jobs are created. And so you do not want a situation where there are policies, laws, regulations that constitute impediments to the welfare of the small business sector. This is very, very important. Now, one other thing that I want to impress on us, and it's not really a question as such, is the fact that, as a colleague of mine in the Free Market Foundation once stated very assertively, that it is not the owner of the business that really is primarily regulated. No, no, it is not the product that is regulated. It is the owner of the business that has these products on offer that is regulated. For example, when it comes to liquor violations of any liquor bylaws, and the inspectors, the enforcement inspectors, do not go into the business premises and just ignore the owner and say, where is that errant product? We want to penalize it or whatever. They look at the owner. You have violated some of the regulations, and so that's something that's very important to know, and also something that Gary throughout has emphasized in his own words is the fact that regulations have all regulations have cost implications. So that cost is being borne by the business operator. That is something that should be borne in mind. And then also moving on to, say, the roadside meat facilities where they slaughter at the premises and sell and buy the meat and offer to the customers. Anecdotally, I have not heard of any single case where there was a situation of food poisoning. Now, I used to meet a great deal with some farmers in the Eastern Cape and also in the Bloemfontein Orange Free State area. Sheep farmers told me that when I told them about the roadside butcheries and meat sellers directly to for consumption, that they said that meat that gets slaughtered there is actually the healthiest. It's the healthiest. And I said, please, you need to enlighten me about this. They said, it is the healthiest because the thing is, it's not going to be kept aside or refrigerated over a couple of days and so on, which is why they said, they explained that food poisoning tends to occur amongst the big businesses, the restaurants, the sophisticated restaurants. And then, then the penny dropped for me. And then I realized that, for example, if the law enforcers or those who contemplate even more regulations, if they were to understand something about the informal food outlets, they must understand that they must treat it or perceive it as an extension of the cooking situation in their family, in their household, where one very seldom ever hears about food poisoning. And so that facility out there, selling to passers-by, to other all sorts of customers, is informed by, in terms of hygienic standards, by what occurs in the household, in the family household. And so this is a very cogent case that Gary has presented. For also the absence, of discretionary powers. Discretionary powers should be curtailed or even just simply, done away with, because they just make things worse and open opportunities for bribery. So where people they might be detected to not having complied with the stipulated regulations. No, that's all I'm stating for now. That's a good book. It's that whole range of books should be given to the appropriate portfolio committees in Parliament, like for example, licensing, finance, laws affecting small businesses. Those should be given to the finance portfolio committee, trade and industry portfolio committee, and the health one to the health portfolio committee and so forth. But then that requires sponsorship. This is where business, the private sector should come in terms of sponsoring the dissemination of these books to the appropriate portfolio committees. Thank you.
Thank you very much for those comments, Themba. Would anybody else like to ask a question or comment? Or Gary, would you like to add something?
No, just say I couldn't. Thank you, Themba. I couldn't say it better myself.
I remember, Gary, when we were doing a submission on one of the tobacco bills, the proposed bills, the proposals went as far as determining the font size on your advertising. And I just found that extraordinary to think that Parliament is sitting discussing font sizes when the economy is falling apart and we've got, 10 million, 11 million unemployed people. It seemed like a waste of their time and energy, and certainly of ours. If there aren't any other questions, Gary, I'd like to say thank you very much indeed for joining us today. I really appreciate it. And I particularly appreciate all the work that you've done on rejuvenating this series for us. Thank you, everybody. Thanks for joining
Thanks,
us.
Gail.
Okay.
Yeah,
Bye, everybody.
Oh, bye.